Environmental health is a broad profession which keeps public health and protection at its core. Often, improving public health means working alongside other services to make one team dedicated to improving the lives of others. This was the case at the City of Lincoln Council, whose intervention team sought to do just this.
So I'm Francesca Bell. I'm the Service Manager for Public Protection, Antisocial Behaviour and Licensing, and I also manage the intervention team here at City of Lincoln Council.
Francesca and her team won the CIEH Excellence Awards for Best Innovative Environmental Health Solution in 2019. The project was set up in the autumn of 2018 to combat an increase in antisocial issues that appeared over the previous 2 years.
Within City of Lincoln, we've seen quite an increase in sort of on-street homelessness, but also sort of our on-street community, not all of which are homeless, but we've seen quite an increase in drug use and sort of associated antisocial behaviour on the streets. And the public generally didn't know how to respond to that, and they were obviously quite distressed and concerned by what they were seeing.
We had a big problem in the city centre with people being under the influence, people drinking alcohol.
Most of the issues seen by the team are the result of mental health conditions brought about for a number of different reasons.
Mental health affects all of us, every single one of us. There are people out in the community that have severe and enduring mental health. You know, there's people on the streets, some people have schizophrenia, some people have bipolar affective disorder. There's also other people that have that low-level depression, anxiety relating to their circumstances.
You very rarely would come across a rough sleeper who didn't have anxiety or depression in one shape or form. It's just to what degree. Sadly, drugs is a massive factor in that, illicit substances, which we know can cause mental health problems as well.
Substance misuse is one of the key issues that the team tackles. To address this, the team includes an action worker who's able to offer advice on treatment or safe use.
On the day-to-day when we're out and about, mental health and substance misuse are two quite prominent issues that we face. Predominantly NPS, so that's novel psychoactive substances like Mamba or Spice. So yeah, people would be sort of very sedated, sometimes almost in like a comatose state in town, and it isn't very pleasant for the people who are out and about just doing their shopping or going about their daily life.
The subject of environmental health encompasses public health and protection, and with a strong background in environmental health, Francesca's base knowledge provides valuable insight.
I think the importance of environmental health to this project is really around, deprivation and determinants of health, which I know is really rising on the environmental health agenda. And I think typically when we say environmental health, we think about food and health and safety. And I think with this project, with the intervention team, it's about that broader community health.
There's lots of environmental things that can affect people, and it's not necessarily their own health. It can be things that are happening around them, especially with this client group. The substance misuse which happens, it can be quite volatile out there. The impact of what's going on around them can have, a detrimental effect on their mental health. You see a lot of it, don't you, with people that live in houses, for example, and their neighbours can cause a lot of noise, or their neighbours can live untidily, and that affects people.
There are a number of challenges that the team encounter on a day-to-day basis.
We come across verbal aggression a lot. I would say that was a daily occurrence. That is just a case of walking away from a situation. A lot of the time it's because they're withdrawing from whatever drugs they can't get hold of, so we have quite a high threshold for people that we'll deal with.
Building and regaining trust between public services and the client group was very important. The relationship between clients and services has been fragile in the past, making this a difficult starting point for the team. However, 18 months into the project, the team has been able to build trust with their clients and has been able to work more effectively as a result.
But I think the more we talk to them, the more they open up. So it's just a case of bearing with them, really, starting that conversation and just keep having the conversation, and slowly but surely they do open up.
Sometimes organisations and other people look at people's behaviours, but they don't always look at what causes that behaviour. And especially the client group that we come across within the city centre have quite challenging behaviour. But if you dig a bit deeper, there is usually an underlying issue, something that's caused that and their reactions and why they behave like that. And I think it's being open and feeling comfortable to ask the question, you know, how is your mental health? What can we do to support you? Is there anything that we need to know? We just go around and like now just see who we can see and catch up on sort of what's going on.
And just see if we can find any more of our client group or anybody else that could be somebody that might need our services or support.
We spoke to one of the team's clients to help understand what impact they have had on their life.
About a year and a half, 2 years ago, I was living underneath a bridge near the Odeon. Do you remember?
Yeah, I remember that.
But then, like, these guys came along and helped, and I ended up in an hotel, at the Travel Lodge for about 4.5 months. And then I ended up getting my own flat.
Really?
Yeah, because these guys helped and other people did help. That was a lot of people. It's a good thing that they do because, you know, we can go up and speak to them. Like I've had this problem this morning, you know what I mean, but I can go up and speak to them. I know I can approach them anytime. And they always give you 5 minutes, even if you've got an appointment, they give you 5 or 10 minutes to talk to you, which is pretty good, man.
They're quite a vulnerable client group that are often overlooked by society. And if we could do something positive to change their course in their life, then that would be more beneficial. We've got a 15-bed unit in the city for people that have got like the most complex needs. But when you put 15 complex needs people together, that's not without its own set of challenges and problems. You know, and then it just becomes a beacon for, like, you know, if they've got drug problems, it's a beacon for drug dealers, isn't it? Because they can come and sell all their drugs to all these vulnerable people in one place. So it becomes really difficult.
Establishments exist within the city that provide temporary housing to those who most need it. Speaking anonymously, one resident spoke to the team about what challenges he has faced in seeking help.
I think it's the stigma that you've got the addiction.
Yeah.
And people don't want to come forward.
Yeah.
So other than just talking to people, I've had to be quite open because it's got a massive problem now. So
this group become quite isolated from services and from other members of the community because they don't know how to interact with one another. And as I said before, the public really want to help, but they just don't know the right way to do that. And if we can facilitate how that could happen and how that might look, then I think it's sort of incumbent upon us as services that have public health, you know, at the heart of everything we do, and community safety at the heart of what we do, to try and help that to flourish.
Working closely with police services has also proved to be important for this project.
Just heading down into the city centre. We think that the police units are around down the city centre as well, so we might see them.
We found out what impact this has had.
They support us, you know, when we're dealing with people, it might be an issue that we can't necessarily solve right there and then or provide some sort of support with. But these guys can come in and they can offer a lot of things that we can't. You know, they've got different training, different skills that normally we would have to try and wear lots of different hats in order to do our job, and they wear all those hats, they can do that, those sort of things. So the two teams working together, I think has really made a big difference.
We can't police our way out of a homelessness situation. It's a societal problem, not a police problem. As far as I know, this is the first time, certainly in Lincolnshire, that we've embedded the police with the council and their antisocial behaviour, public protection and an intervention team. We now couldn't operate without their help. They are that important to the work we do.
Go walk through Lincoln High Street 2 years ago, you know, it was a completely different picture to what it is now. It's not perfect, but it's a work in progress, and it's definitely a damn sight better than what it was before.
I think it's quite an exciting project in terms of a slightly different slant on environmental health as well, and just showing what can be done in communities. But it was only when we really started talking to people, alongside having a mental health nurse and an addiction worker, to understand what drives people and what's driven them to where they are, that we've really understood what chaos means and just how complex is. And I think just seeing the willingness of services to come together has been a real eye-opener.
Without the city intervention team's support, I would say that risk of reoffending would be a lot higher because they don't have that support out there on the streets. I think the City Intervention team provide a safe place, a safe space and a safe face for somebody to go to. They've got that familiar face that they can go to if they need anything.
I think what we see particularly around our client group is that they've got some of the poorest mental and physical health, and without without services getting involved with them and taking those services out to them and making them accessible, there is sort of the chance for them to just be completely overlooked.
We just have to keep trying and hope that one day there will be that window of opportunity for them to carry on with their lives.
Just building that rapport with somebody and having that engagement and feeling that you're making a difference, it's really rewarding, a lot of the time.
Yeah, it is really rewarding when you see sort of people's life change in that kind of way and they seem much happier.
Every time we see them, we would be there to offer that support at all times.
I think the reality is that funding for the project isn't mainstream at the minute. And there's a real risk that the project won't continue beyond October 2021. So how we embed our learning and some of the processes that we've developed, I think will be the real key to making this a longer term success.
A range of different services were able to come together to work towards a common goal, to benefit various communities by reducing antisocial behaviour and improve public health. The drive to improve the lives of others embodies the spirit of environmental health. Collectively, the team has helped to improve the lives of many individuals and shown that little by little, seemingly small solutions can make the greatest difference to communities and show real change.